Hi, this is Dr. Simmons from the Chiropractic and Kinesiology Center. Today we're going to talk about the top 10 questions that we get in our clinic. The first one is, what is a subluxation? And basically, that is when the bones of the spine, the vertebra, actually move out of place. They get misaligned. They put pressure on these spinal nerves. When they do that, these nerves cause tingling, numbness, and a variety of other symptoms. So a chiropractor's job is to realign these spinal segments and release the pressure off of these nerves. The second question that we get is, what is the popping noise when I get adjusted? Really, the popping noise has nothing to do with the quality of adjustment. Sometimes we get a loud noise, sometimes we get a quiet noise. This popping is just gas coming out of solution. It's the same noise that you get when you pop your knuckles. So it doesn't cause any problems or any degeneration. It's just a noise that occurs. The third question is, will the adjustment hurt? We like to say here, if the adjustments hurt, who would come back? No one wants to be in pain after every adjustment. Well, what can happen, especially if you've never been adjusted before, you get what we call like an exercise sore, which is kind of like if you decide you're going to do 50 push-ups today and you hadn't done any push-ups. You're going to feel some soreness in the area, and if that happens, you can put some ice or heat on it, depending on what we recommend. The fourth one is, how long will the adjustment take? Usually the adjustments take about 5 minutes, and that just depends on what we do on that particular visit. Number 5, do we need any x-rays? That depends on a particular case. What we do is take a comprehensive exam. If we find that you've had some kind of trauma or accident, we might require you to take x-rays before we'll proceed any further. Generally, we don't x-ray children or pregnant women as a rule, unless the children have had some kind of fall. We've had some kids fall off of trampolines on your head, and then we'll want to take a film on that. Number 6, do you adjust children? Yes, we adjust everything from infants to the elderly. With very small children and infants, often it's just the pressure of a pinky against the spinal segment, and that's enough to move it because they don't have a lot of muscle tension. Let's go to number 8, which is, why does it take more than one adjustment? You have to remember that the things that we're working on are things that have been going on for years. So for us, it takes time to overcome what the body has done, which is compensate. It's adjusted itself so that you can still function. So what we have to do is realign the segments and then convince the body that this is the correct area, and the body will recognize that and then start holding the adjustments for longer periods of time. But it does take more than one adjustment to do that. Number 9, does my bed have anything to do with my problem? We hear a lot about mattresses, and yes, that can. What happens is, if you look at your mattress and you see there's a big hole in it, that definitely means that your mattress needs to be either flipped or replaced. And we found there's really no such thing as a no-flip mattress. Most of them recommend that you flip them every 6 months anyway. Also, if you feel like there's springs, if you feel the springs when you're laying down, that's another sign that your mattress is worn out. The other thing that we also do recommend is to check your pillow, because you want a pillow that's going to support your neck area, and that will take the strain off of your spine. Number 10, what's the best way to sleep? The best way to sleep is generally on your back with a good cervical pillow to help retrain that neck curve and also keep the stress off of your neck when you're sleeping. You can also sleep on your side. The worst way to sleep is on your belly, because that causes low back and neck strain. Be careful when you're sleeping on your side. We have a few patients who have slept on their side, and they've actually, from the way they've turned and sleep, they actually can cause problems with their shoulders or their clavicle. So those are the top 10 questions that we pulled in our clinic. Hope you found it informative. Hope you learned something new today. Check out our other videos if you want to learn more about different topics. And as we always say, have a great day and make good choices today.